Ladies and gentlemen, thank you for standing by and welcome to the Foundation for a Healthy Kentucky Go to the Source KHIP and Oasis webinar. During the presentation, all participants will be in a listen-only mode. If you would like to ask a question during the presentation, please use the chat feature located in the lower left corner of your screen. If you need to reach an operator at any time, please press *0. As a reminder, this conference is being recorded Tuesday, May 21st, 2013. I would now like to turn the conference over to Sarah Walsh. Please go ahead, ma'am.
Thank you so much, Carlos. Well, welcome everybody. As he mentioned, I'm Sarah Walsh. I'm with the Foundation for a Healthy Kentucky. Before I hand things over to Jennifer and Mark, who are going to be our primary speakers today, I always like to take a minute to tell you a little bit about what this training series is intended to do. If you've participated in one of our Go to the Source webinars before today, well, this will be a bit familiar. Just bear with me. Some of you may also be familiar with the Foundation's Health for a Change training series. Go to the Source was really born as an extension of that. For the past couple of years, the Foundation has offered workshops and webinars to support the work of emerging and established health coalitions and nonprofits, the people who are really doing the important work of promoting health and advancing health policy in the Commonwealth. So this year, we wanted to expand that effort to specifically address the needs of data users. So if you are a researcher, an epidemiologist, a grant writer, if you got stuck being the map coordinator for your health department, or you were handed the responsibility for your hospital's community benefit plan, whoever you are, if you are serious about using health data, then Go to the Source is really designed with you in mind. I always like to begin with my obligatory shameless plug for Kentucky Health Facts. The Foundation launched KentuckyHealthFacts.org in 2008. This site is designed to provide anybody, data pros and rookies alike, with an overview of health needs and resources for their community. But let's be honest, sometimes you need to dig deeper than the data that's available on Kentucky Health Facts. Sometimes you've got to go back to the original sources of information to learn more. So that's what we're doing with Go to the Source. It's to introduce you to some of the key health data tools and resources that Kentuckians can use and the people who are behind those tools, so you know where to turn for answers. Before we begin today's discussion about the Kentucky Health Issues Poll, I wanted to remind you kind of where we are in this series. If you've not signed up yet, you can register for the other Go to the Source webinars from a link on our website at healthy-ky.org. And if you missed them, the first 3 webinars on our series, one was on Health Landscape, which is a free web-based mapping tool that you can use to visualize kind of existing health data sources or upload your organization's own data. We had a webinar on the Kentucky Behavioral Risk Factor Surveillance System, which is really the premier source for population-level data on health status and health behaviors, stuff like tobacco use and exercise in the state. And one on the Kentucky Medicaid Pharmaceutical Utilization Guide, which is kind of a mouthful, but an eye-opening look at prescribing practices and medication usage across the state. So all 3 of those webinars are archived on our website. And where we go from here is that next month, Michael Price is going to tell us a little bit more about the Kentucky State Data Center. They're really our connection to the U.S. Census Bureau here in Kentucky, and they have great information on demographics and the economy and kind of that population-level information that underlies all of our health statistics. Then in July, I'm going to be talking about the Foundation's Kentucky Parent Survey. And Amy Swan is going to show us around the new Kids Count Data Center 2.0. The Annie E. Casey Foundation sponsors that as a data repository of children's health information. And an updated version is launching later this summer, so we'll get a first-hand look at how to navigate that. Because this is our first time offering Go to the Source, this is my other shameless plug of please let us know what you think. If this is helpful, we try to repeat the series. We can do this again next year. We may expand it to cover different data sources. If it's not useful, we want to know what to change so that we can make it meet your needs. You're going to be getting an email from us probably tomorrow. It will include a link to a short evaluation. It is just 4 or 5 questions. Please take a minute to answer it. we are data people. I can't stress enough how much we really rely on this data to help us make decisions. So with all of that said, let's talk about what we're here to talk about today. Our speakers are Jennifer Chubinski and Mark Carozza, both from the Health Foundation of Greater Cincinnati. Jennifer is the Director of Community Research at the Health Foundation, and she directs the Foundation's efforts to improve regional health through original data research, improve data access, and standardization. She leads several data collection projects for the Health Foundation and has been my partner in crime on the Kentucky Health Issues Poll for a couple of years now. And Mark Carozza is the health informatics developer at Health Landscape, which is a subsidiary of the Health Foundation of Greater Cincinnati. And Mark is responsible for the development of web-based data systems, including the Health Landscape web-based mapping tool that we showcased in an earlier webinar, and Oasis, which we're going to be talking about in greater depth today. So without further ado, I'm going to hand things over to Jennifer.
Thank you, Sarah. My partner in crime. I think that's a good title. So I'm going to talk today about the Kentucky Health Issues Poll, our analysis of the poll, and how you can get access to the things that we've decided to look at and analyze, and also contribute suggestions for things that we ask on future polls. And that will take probably about 10 minutes. And then I'm going to hand it over to Mark, who's going to show you Oasis, where you can get access to the raw data for the most recent Kentucky Health Issues polls and all of the previous Kentucky Health Issues polls. And you can do your own analyses for issues that are of concern to you. So the Kentucky Health, The Kentucky Health Issues Poll is a poll that the Health Foundation of Greater Cincinnati does in partnership with the Foundation for a Healthy Kentucky. The Foundation for a Healthy Kentucky, as all of you probably know, covers the whole state of Kentucky, and we, the Health Foundation of Greater Cincinnati, cover the northern Kentucky portion of Kentucky. So we work together to do the survey for the whole state and also do some regional focus. So the survey is about 30 questions long. We talk to around 1,600 Kentucky adults via landline and cell phones. It's a RDD survey over the phone, so we call people and ask them health policy questions over the phone. The sample size is large enough that it allows us to look at regional variation. So with the sample size of 1,600, we are able to break the state into 5 groupings of ad regions or combinations of ads to look at regional variation. And we've been doing the survey since 2008. The foundations, namely Sarah and I, work together to craft questions, but the data collection is done by the University of Cincinnati's Institute for Policy Research. So let's take a quick look at some of the data we have from the Kentucky Health Issues Poll. One of my favorite data points is this one. So this is looking at public support for the smoke-free law, and the question that we asked is in green at the top of the slide. Would you favor or oppose a state law in Kentucky that would prohibit smoking in most public places, including workplaces, public buildings, offices, restaurants, and bars? And you can see the darker gold line that's on top of the graph shows an increasing favorability rating from adults in Kentucky. I don't know if I mentioned that before, but this is Kentucky adults, so we're only talking about public opinion from adults over 18 in the state. And you can see that the opposition has also been decreasing. So this is the kind of trend line that we in public health really like to see. And it's these data have been shared in various forms with advocates and public policy and legislators in the state. So this is an example of data that we've asked on repeated polls, and I want to show you another one of the data of the graphics that that is one of my favorite. This is another thing that we track survey year to survey year So this is insurance, insured adults age 18 to 64. So this excludes seniors because of their high rates of having a Medicare coverage. And this is a trend that we've been following over the last couple of years. So you can see that each line is a different type of health insurance. You see at the top of the graphic in employer-provided insurance, and you'll notice a downward trend. Then the sort of more golden line in the middle has been jumping around the mid-20s, low 30s. Those are the uninsured adults in the state. The lighter colored line, the third one down, is folks who are on public insurance. So that's, for purposes of this analysis, Medicare, Medicaid, military benefits, and any combination of those three. So any forms of health insurance which are paid for using tax dollars. And then the bottom line is other, and those are generally people who are purchasing their own insurance on the private marketplace. And so the trend that we've seen here is the downward direction of people getting insurance from their employer or from their spouse's employer. So the top line coming down from 55 to 37. And the upward trend of the third line, or the public insurance line, going up from 10% in 2008 to 27%. And this is a trend that we're seeing in Ohio, another state that we do a similar survey in, and across the nation. It just happens to be more aggressive and dramatic in Kentucky. So this is another example of data that we collect year to year on Kentucky and release the data within weeks of having it, so it comes out much more quickly than a lot of the federal data sources that do the same sort of tracking. We typically, though, on KHIP, do a lot of questions that are 1 year only and don't have these trend lines over time. And some of the examples of data that are available from the most recent Kentucky Health Issues poll are, we asked about questions about people's comfort level with mid-level healthcare professionals, so whether people are comfortable being cared for by nurse practitioners and advanced dental hygienists. We also asked public opinions on medical marijuana and whether voters should be allowed to vote on medical marijuana. We asked about questions about barriers to getting oral health care, among many others. So year to year, we tend to vary the questions that we ask depending on what's happening in the policy arena and what our priorities for the foundations and the communities that we serve. So you can see the next slide shows our analysis. So when I say our analysis, I mean the two foundations analyses, the data analysis that are released. On the left, you see the smoke-free law data that we talked about before. And if you were able to read this, you would see some of the context and background around the law and the reasons for the suggested change in policy. And on the right, you see the same document for health insurance. And if you go to either one of the foundation's web pages, our link is at the bottom of the slide, www.healthfoundation.org, or to the Foundation for a Healthy Kentucky's website. You will find, I think we did, what, about 10 of these, Sarah, this year? Covering all.
Teens.
We were in the teens?
There was 15 this year. We were crazy.
So a lot. There are a lot of issues that I'm not going to cover in this webinar, but the analyses are available at both foundations' website. And soon we will also be releasing regional specific data for the 5 regions of the state. So here is an example of the analysis that you will see that's available from our website. There are also ways to suggest questions you'd like to be asked on the survey, and we take your suggestions very seriously. This is the formal submission form from my webpage, from the Foundation for the Health Foundation. An email to Sarah or I would also suffice. This year we added questions around HIV testing because somebody asked that we ask those questions in Kentucky. And every year we invariably add 1 or 2 based on what people in the community are interested in knowing. And as I talked about earlier, all of the data from the Kentucky Health Issues polls are available on 2 different web portals. One is Health Landscape, which is an amazing map-making tool, and the other is the Oasis system, which I'm going to let Mark explain to you right now. So over to you, Mark.
Okay, thank you. Again, my name is Mark Carozza. I'm with the Health Foundation, and I am going to share my screen here. And start walking you through what's going on with Oasis. As Jennifer mentioned, Oasis is a web-based statistical analysis system that we created some years ago. The idea that the foundation was investing a good deal of dollars in data collection for community surveys, statewide surveys in Ohio and Kentucky, and that data would sit at some university researcher's computer and really didn't get out to the public where it could be available to researchers and to people who had more interest in the data. So we created this system called Oasis, which stands for the Online Analysis and Statistical Information System, where users can come in and use the original micro-level, person-level data to do whatever additional analysis they would like to do. Typically, from a survey, you see top-line results like frequency distributions, and the occasional crosstabs so you can see smoking status by race or by sex. What Oasis allows you to do is do very detailed analysis, frequency distributions, cross-tabulations, analysis of variance, even advanced analysis like logistic regression and what have you if you're so inclined, using the original person-level survey data. Oasis is available at www.oasisdataarchive.org. When you come to the site, we do ask you to become a registered user. There's no cost for you using Oasis, but this allows us to keep an accounting of how many people are using the site and what data sets they're most interested in. Registering for the site is fairly straightforward. You enter in a username and password and then some other pieces of information. What we're going to do today is go straight into the site, and once you've logged in, you come to a screen that lets you look for studies that are available, look at some of the use policies, change your user profile. We're going to go ahead and jump straight into doing some analysis by selecting the studies that we're interested in. So we select on Studies in the menu bar. At this point, you come to a screen where you can select one of our many collections of data. For example, we have data from the Health Foundation of Greater Cincinnati. We have data from collections of data from the Ohio Department of Health, any number of different data collections. Today we're going to focus on the Health Foundation of Greater Cincinnati, and in particular the Kentucky Health Issues Poll. You see we have the Behavior Risk Vector Surveillance System. We have any number of data sets. We're going to go straight to the Kentucky Health Issues Poll for 2011. So we'll select that and click Continue. That will take us to the next menu where we can select the type of procedure that we'd like to do. Again, a frequency distribution, a cross-tabulation, what have you. We'll start with something simple. We'll start with a frequency distribution. So we select frequencies and click Continue. Now at this point, there's a lot of questions, a lot of information that it could ask you for. A lot of this can be ignored. One thing I do want to draw your attention to right off the bat is the right-hand side of the screen. It's telling you that we're using the Kentucky Health Issues Poll, and you see 4 files. The first thing you see is the code book. The code book tells you a great deal of information about the data. It tells you how the data was collected, why the data was collected, what the population the sample was drawn from. If there are survey weights that belong with the data, the survey weights are documented. This is complete documentation for everything you would need to know to use the data appropriately. I cannot encourage you enough to use this document, to take a look at it, to see the actual survey questions. It's a very important document. If you're someone who has SPSS or SAS or some other statistical system and you really just want to get to the data, below that you see the raw data and you see sample SPSS and SAS programs. So potentially a user can come in, get this far, download these 4 files, and never come back to Oasis. They can do everything on their local machines with their own software. Assuming that you don't have those resources, that's when you'd need to use a system like Oasis. A nice little cheat that we have on the screen, if you scroll down, you see a codebook summary where you see the variable. So you see area weight 1, education, kids, Q15R, and for each one of the variables, you see a brief description of what that variable is. So that HH size, you can see that that's household size. For Q13, you see that it's a question whether or not they favor or oppose the 2014 law in regard to paying a fine rather than have insurance status. So there's a lot of detail that's available to you on the screen, but it's also very important for you to take a look at the codebook. So I'm just going to go very quickly and do a quick frequency distribution on, for example, the insurance question. Here's a variable called insure. We can scroll down and take a look at the codebook, and we see that the insure question is whether or not they have health insurance. So we clicked on insure. I've read the codebook. You've read the codebook. You now know that you need to weight the data. So we're going to select region weight. And simply by selecting that variable and selecting an appropriate survey weight, we can now click submit, and the results come to the screen. Now, you also see the secret behind Oasis, which is that Oasis is really just a web-based front end for SAS programming, and Oasis writes all of this SAS code for you so that you don't have to do this work. But again, so you see right here from the results, in Kentucky in 2011, 26.11% of the population did not have insurance or didn't know whether they had insurance. All right, so I'm going to just go in and do some other analysis and show you some of the other features of the system. We're going to go back. If we want to, we can do multiple variables, so we can select the insurance question, and we can select the Q13 and Q14. And again, just by clicking submit, receive the results for these 3 survey items. Again, the insurance question, whether or not they favor or oppose parts of the 2014 health reform law, and whether or not they favor or oppose providing access to affordable health care to all Americans. And again, this is straightforward results from the Kentucky Health Issues Poll from 2011. And the thing to note is that this is not pre-digested, pre-crunched data that we're making available. You're actually using the original 1,500 and so, 15 or 1,600 survey responses that are in the data file, and you are doing original analysis here. So let's go back and take a look at the same insurance question, this insure question, and let's look at that by some demographic characteristics. So instead of doing a frequency distribution, we'll do a two-way cross-tabulation. So we'll come here, select two-way cross-tab, click Continue. Our outcome variable or our dependent variable is going to be the insure question. In our predictor, for predictor right now, let's look at education level. So we're trying to see whether or not there's a difference in insurance status based on the adult's education. And again, we'll use the appropriate weight, which in this case would be region weight. Click Submit. And now you see a cross-tabulation of insurance status by education level. Less than high school degree, some college, or college graduate. And again, this is not pre-digested data that we thought that you would need in advance. This is something where you've decided, I would like to see insurance status by education, or insurance by race, or insurance status by some other indicator. We're actually going to select multiple indicators where we'll look at education and employment status. Doing the same results, here we see insurance status again by education and insurance status by whether or not they're employed full-time or part-time, whether or not they're unemployed, or whether or not they're a student or keeping house. It's very simple to go in and design your own set of crosstabs, your own set of tables to help explore the data that's available to you in the Kentucky Health Issues Poll. Okay, question that we also get when using this system is it possible to look at any inferential statistics or any other statistics besides just counts and percentages? Well, certainly it is. So let's go back to the procedures, and we use a very simple type of analysis called measures of association. If you're familiar with the idea of a crosstab or of a chi-square or any other measures of association, that is very simple to do. We'll select measures of association, click Continue. Again, we'll look at our insurance status question. And again, we'll look at it by our education level. And here we can select any one of these types of measures. So we can select chi-square statistics, we can select a Summers D, Kendall's Tau B. And again, I'm going through and very casually selecting these statistics. If you're actually using Oasis, you should take care to make sure that the statistics that you select are appropriate for your analysis and for your audience. If you're doing a very simple one-page report that mostly has a public consumption or going out to the media, you probably don't want to spend a lot of time doing factor analysis and logistic regression and some of the more advanced techniques. You really need to show caution about which type of analysis you're using when you use Oasis. So go down, also select the rate variable that we've discussed, and click to submit. And you see the same cross-tabulation that we saw before, the insurance status by education level, but you also see any number of inferential statistics, including chi-square, Kramer's V, lambda, Summers D, a lot of information that you can use and you should use with a certain amount of caution. But it's very simple, as I've shown you, very simple to select a type of analysis. Okay, I do want to go back and show you another feature of Oasis. Okay, I'm looking through the list of variables that are available to you, and there are a lot of information, 30 or 40 variables in this data set. I'm going to go all the way down to the bottom, and you see that there's a variable called region, which tells you the geographic region for the analysis. So I'm going to go back up here and, just out of curiosity, get a frequency distribution of that region variable. I'm not going to worry about applying weight. I'm just going to click submit and see what it looks like. Okay, so it looks like this region variable tells me that 320 respondents are from Western Kentucky, 332 are from Louisville area, 319 from Lexington area, let's see, 329 from the Appalachian Area Development Districts. So that's good. Looks like we've got some good representation from around the state. But you know what? I'm mostly interested in analysis of the Appalachian region. We have 329 observations, so that's enough for me to at least look at some very simple results. Obviously, you can't do detailed analysis. So what I'm going to do is go back and do some very simple analysis looking at this insurance question again, but instead of looking at it by demographic characteristics, we're going to look at it by geography. So we'll select the insurance question. Actually, we'll select all three insurance questions. Oops, wrong procedure. We'll do it. Again, we'll go back and do a two-way crosstab. I was in the wrong procedure. So we'll do a two-way crosstab, select the insurance questions, and cross that by region, and click submit. And now you see the insurance questions, all three insurance questions, or all three insurance recodes by the different regions of the state. So here's the question that specifies insured versus not insured. There are additional calculations where it's insured versus insured but have been uninsured in the past month, and then also insured. So there's different ways of looking at the insured question in the KHIP data. But you can see right away it's real straightforward, real easy to do some very detailed analysis and very detailed cuts of your data. One thing I want to show you up in the top left-hand corner, there's a little link here that says click here to look at this results, look at this output as an Adobe Acrobat document. If you click here, very straightforward, Adobe Acrobat document opens up. You can now send this to the printer. You can now save this to your desktop or somewhere on your computer and use this later on without having to come back to Oasis for additional analysis. Okay, I do want to show you one more piece. Go back, do a frequency distribution. Again, look at the insurance question. We could be looking at any item, but I'm going to specifically look at just the Western Kentucky results, which, if you remember from the results, we had Western Kentucky, Louisville, Lexington, Appalachian area. Western Kentucky was the first category. So I'm going to go down over here on the right-hand side where it says define a condition. I want to go down to my region variable and create a condition that says region equal to 1. Okay, so what I've done now is I said I want to get the insurance results. I want to get the results to the insurance question, and I only want to get the results for the first region category, which was for Western Kentucky. We'll still select region weight and click Submit. And here you see the frequencies. The following selection filter has been applied where region equals 1. The following statistical weight was applied, region weight. And here are the results for just Western Kentucky from the insurance status question. We'll go back to the study section just for a moment, just to remind you that all of the data are available in Oasis. The Kentucky Health Issues polls are available from 2008 through 2011. And any of the results that you saw just now, you could do for any one of those years. And I think that I'm going to throw it open for questions and discussion, if that's okay.
I think that's just fine. We've thrown a lot of information to all of you, and we did that knowingly. We know you aren't going to totally master Oasis until you've played with it a couple of times. But if anybody has questions about either the poll, the Kentucky Health Issues poll, or the Oasis system, you can enter those into your chat box, and we'll go through those as we get them. I have a couple of preliminary questions that I've got here. Mark, I noticed you were showing us the 2011 Kentucky Health Issues poll data. When will the 2012 data be available on Oasis?
So the 2012 KHIP data, the 2012 KHIP was fielded late fall, and we ran analyses through about now. So after we release the regional reports in the next couple of weeks, the Institute for Policy Research will give us the raw data, and we will put it in Oasis. So I think we'll have 2012 data in the next month. That's my best guess.
Okay. That's fair. We'll take a best guess. And I'm struck, Mark, there's so much information in Oasis. How do you protect the privacy of survey respondents when we make this data available to users?
That is a great question. At a bare minimum, what we do before we release any data is we go through and make some decisions based on two things. The amount of geography that we release and the amount of detail that we provide in demographic data. So for example, you'll notice that the only geographic information that you had in the data file was one of those 5 regions. So you really can't identify anyone beyond those 5 parts of the state. The other thing that we do is we very purposefully go in and collapse geographic categories. So you're not going to see single years of age. You're not going to see detailed, I'm not sure if the KHIP has it, but if there were questions on Hispanic origin, you wouldn't see detailed on the differences between Puerto Rican and Mexican and other Hispanic Latinos. We very carefully go through and balance what we can to reduce the amount of geography and reduce or collapse the demographic categories, specifically so you can't identify, that 37-year-old white male that's 340 pounds in Bracken County, because chances are that's Larry that lives down the street. I mean that's an identifiable person. But if you know that there's someone who's in white male 35 to 40 who lives in the northern Kentucky region, then it's far harder for you to identify a respondent. So we do that. The other thing that we do in Oasis is we don't allow people to do statistical procedures that generate individual record output. So there's no proc print, there's no proc, anything that lists out all 1,500 or 1,600 individual records. It's just not available. And even though you have the power of SAS behind this, you don't have the very simple procedures like proc print and that sort of thing. The other thing that we do, if you go to the policy section of Oasis, right here next to studies, we have this checklist that we go through. This is a checklist that is developed by the Census Bureau and the CDC. It's the same checklist that they use for the BRFIS, for the any of the census data. Before they create their public release files, they go through this checklist to make sure that you really minimize the risk of disclosing individual responses or individual identifiers.
Great. Jennifer, at the very beginning of your talk, you used the abbreviation RDD. What does the KHIP is an RDD poll? What does that mean?
It means random digit dial polling. It's a method for a very standard method for collecting data over the phone that ensures that the whole of your target population is equally likely to be reached via telephone. It's a way of randomly, it's sort of hard to explain without being able to draw a picture, but a way of randomly generating telephone numbers so that everyone in the area you're after has an equal chance of being selected for your poll.
And well, I can't imagine why anyone would want to use any data set other than the Kentucky Health Issues poll. Can you give us kind of an idea of what the other data sets that are available are like? I see there's quite a lengthy list, so feel free to edit.
Sure. Let me run through. Again, I said there's multiple collections here. Just starting with the Health Foundation, the personal drug use surveys, the 2000 and 2010 personal drug use survey, that is the PRIDE survey that's done by the Coalition for Drug-Free Greater Cincinnati. So that is probably 40 to 50,000 student surveys from the Greater Cincinnati area, looking at when they first have they and when do they first smoke cigarettes or smoke marijuana, drink alcohol, have they carried a gun or knife to school. A lot of detailed information every 2 years going back for the last decade. The Behavior Risk Factor Survey System, obviously that's the federal data set. We have that for Ohio, Kentucky, for Ohio and contiguous states. Some of the other data, Child Wellbeing Survey, so that's the Cincinnati metro area child health survey done by Children's Hospital and the Health Foundation. Obviously the Kentucky Health Issues Poll. The Ohio Health Issues Poll is comparable to the Kentucky Health Issues Poll as far as public policy questions around the state. MedShare Program Participant Survey, that was a prescription support program run by the Health Foundation. This is data related to that. Obviously, Regional Health Start Surveys, School-Based Health Center Study. I don't know what the School-Based Health Center Study is. There's a lot of data. The Greater Cincinnati Community Health Data Survey obviously is our local survey. Back in 2005, we did a Hispanic Health Survey. If you're interested in Ohio, the Ohio Family Health Survey is, I don't remember how many respondents, but it's enough so that we have county-level data for insurance question and other type of health cost data for the state of Ohio by county for 1998 and 2004. So it's a fair number of respondents. I don't remember off the top.
52,000.
52,000 respondents. So if you're interested in, again, if you're interested in politics, the Ohio poll, which is Ohio politics, we have a lot of information there. I think that's the bulk of it. So yeah, there's a lot of data. If you're someone who's sitting at a academic institution, U of L or somewhere, and you're looking for data to do research, I would never ever recommend doing primary data collection until you've come here first. This is a wealth of data. Why spend why spend the dollars that you would take to do this if the data already exists?
That's a great point.
Let me repeat something that you said earlier. We just went through and did a lot of pointing and clicking and showing some quick analysis here. But this morning we also did a 3 or 4 hour workshop on how to do Oasis. There's a little bit of a learning curve. Once you've seen it a couple times, you get it. But it's something that I would recommend if you get a chance to come up to the foundation the next time we're doing one of our workshop, or if KHIP would like, I can come down for a half a day one day to do a workshop if you've got a facility to do it. So we can talk about that. I guess I should have talked to you before I said I'd do that, but yeah. I'll let you think about that if you want to do that.
And well, because you guys do have an ongoing series of trainings, and this is similar with our webinar on health landscape, that you do need to play with a little bit and get a feel for it. How do we find out when the Health Foundation's next workshops are? Where is that on your website? Or?
If you sign up at the top corner of the Health Foundation website for our every 2-week, Mark is going there now, thank you, every 2-week newsletter. The upcoming, so up there in the right-hand side, there's a newsletter sign up. If you sign up for that, you'll get notices of the workshops that are coming up in the next month or two. If you navigate through the website to its nonprofit resources, workshops and technical assistance, you can go through there and look at that. There's not much coming up past May because we don't do a lot in the summer because of so many vacations. But there is a workshop coming up. Our next workshop on Oasis and Health Landscape is in November, and it will focus on those tools using the Community Health Status Survey, which is a regional health status survey that the Foundation does every couple of years to monitor the health and well-being of adults in our 20-county area.
And that is a great tool that does extend into Kentucky counties as well.
That's right. It includes the 8 northern counties of Kentucky.
And while you're on the Health Foundation website, would you mind, Mark, going to the data and publications page? Just if we're lazy and want to see the KHIP data that somebody has already analyzed, where do we find that?
There you go. So data and publications, local and regional surveys, Kentucky Health Issues Poll, and there you see the thumbnails of the many, many one-pagers that Sarah and I worked together to produce for this poll.
And you can see this is all just health data, is the green.
And there's a screenshot of Oasis at the bottom to show you can use Oasis, although the 2012 data will be up there soon.
And you guys have archives as well for the previous years of the poll.
That's correct.
Well, those were my questions. If anybody has more questions to chat in, we're happy to take those. We've got a little bit of time. We want to make sure that you get the information you were looking for about KHIP and Oasis.
If anyone has any questions after today, they're welcome to contact Mark or myself directly. We certainly respond to email and phone calls.
And that is also helpful. Well, I'll stall for one more minute to see if someone is furiously typing. But failing that, I want to say thank you guys so much. Mark, every time I see you present, you show me something new that Oasis can do, and I'm always like, man, that's really cool. And SPSS and SAS are crazy expensive, and this is available for free is pretty awesome.
Yep.
And Jennifer, I really appreciate the clarity with which you go through, what KHIP is and what the different pieces that we have are available. So with that, if we don't have more questions, we'll let everybody get back to their afternoon, and thank you guys so much.
Okay.
Thank you.
Thank you.
And we're all set.
Ladies and gentlemen, that does conclude the webinar for today. We thank you for your participation and ask you to please disconnect your lines.